Hello, and welcome to the Thyroid Pharmacist Healing Conversations podcast. I'm your host, Dr. Izabella Wentz, and today we're going to be talking about peptides and hormones and how to transform perimenopause beyond weight loss. I'm so excited to have Dr. Elena Zinkov here. I'm going to give you a little bit more info about her. She is redefining women's health with cutting edge hormone and peptide therapies, helping women over 35 reprogram their metabolism, build muscle, and defy aging. As someone who struggled with perimenopause symptoms in her 30s, she was determined not to settle for what doctors called normal. Frustrated by the medical system dismissing women while they continue to battle brain fog, fatigue, weight gain, and metabolic dysfunction, Dr. Elena set out to change the conversation. With over a decade of experience and having worked with 20,000 plus women, she developed a proven method integrating bioidentical hormones, peptides, and progressive longevity strategies to help women reclaim their vitality and thrive through perimenopause and beyond. Dr. Elena is on a mission to rewrite the rules on aging, empowering women to be their own best health advocates, and proving that midlife can be their most powerful chapter yet. So, we're so excited to have you here. Dr. Elena, welcome.
Thank you so much.
And I'm really excited to dig into perimenopause with you. A lot of us that come into functional medicine, that come into integrative medicine, we oftentimes have our own personal stories that maybe help shape why we do what we do. Do you have a story like that as well?
Of course. Like many women, I suffered from a hormone imbalance when I was younger and in my 20s. And I was given the same option that women are given today, which is birth control pills or antidepressant or anti-anxiety medication, which we know is not a solution for hormone imbalance symptoms. And my mom, who's actually a medical doctor, encouraged me to go into naturopathic medicine because she knew that in conventional medicine, we just didn't have a good option, a good solution for women who were struggling with perimenopause and even other hormone-related symptoms. So a big sort of wake-up call for me was where I really saw the connection between even hormones and how they affect our well-being and even our immune system was postpartum, when after I had our kiddo, I developed two autoimmune conditions, Hashimoto's and rheumatoid arthritis. So over the last decade and even more than over 10 years, I've been really on a mission to empower women and help women understand that perimenopause is not the end. It's just the beginning of the best chapter of their life.
I love that. Now, a lot of times women may be misdiagnosed, and some doctors don't really know how to diagnose perimenopause. And, it's sort of kind of a mystery. Like, is it just the year before menopause happens? Does it start when you're 25? Can you tell us a bit more about perimenopause, what it is, what it isn't, and how to properly diagnose it?
Yeah. Unfortunately, a lot of women, when they go to their OBGYN or maybe their primary care physician, and they're complaining about maybe some changes in their menstrual cycle or changes in their mood or their energy levels, or even a common complaint that usually happens when our hormones are out of balance is weight gain. Women get dismissed and they're told that, well, we can't test your hormones and perimenopause is really tricky and your hormones fluctuate. And because they fluctuate, we can't test them. Whereas I'm on the bandwagon that we should test those fluctuations and we should be able to see what's going on month over month in the different stages and years of a woman's life. So just to provide a little bit of a context, our hormones start to decline in our mid-20s. So it's not that big of a surprise that some women actually start experiencing some signs of perimenopause, which is a shift. Perimenopause is a shift in our hormones, in our ability to produce hormones and our ability to receive those hormones via receptors, right? So it's not a surprise that if hormones start to decline in our mid-20s, that we're going to start to see this shift happen potentially in our 30s. And it varies woman to woman because some women experience perimenopause in their 30s. Other women start to experience this shift in their 40s. And on average, a woman technically can enter menopause and being postmenopause between the age of 45 to 55. So that's an average. Everything leading up to that, from the time that you start experiencing this shift to menopause, postmenopause, is technically perimenopause. And for some women, it can happen very quickly. It could be a month, it could be a year, it could be 10 to 15 years. So I was one of the lucky ones that entered perimenopause postpartum. And it was marked by a major shift in my hormones. So our bodies love estrogen. So like many women, I tend to be on the estrogen dominant side. I wish I was more testosterone dominant or progesterone dominant, but that's not the case. So what happens when we're starting to enter the early stages of perimenopause is, one, we can notice a change in symptoms, a change in our cycle. So all of a sudden, you feel like you're going through puberty again. You're getting acne, you're getting painful cramps, you're moody half of the month, and then your husband is complaining that, why is your libido low? Because they're starting to feel neglected.
Check.
Check, check, check. Yes. So perimenopause, especially in the early stages, is mostly a change in how we feel due to the shift in our hormones that can also be marked with, let's say, reproductive changes, including our menstrual cycle. As we progress through perimenopause, or depending how quickly we go into perimenopause, we can start to actually validate it with some data. So this is where we can start to see, wait a second, my estrogen is high, relatively speaking, based on the labs, but my progesterone proportionally is starting to show on the lower end, and testosterone is starting to dip, and potentially even thyroid is starting to dip. And then it becomes a chicken or the egg thing. Was it the thyroid that started to dip and all the other hormones followed? Or was it just part of the whole picture? And when women are having a conversation with their healthcare provider, it's perimenopause, and a lot of female hormonal issues have been sort of grouped under estrogen and progesterone. Yeah. And a lot of other hormones have been left out of the conversation. So we frequently talk about testosterone and PCOS, and I actually don't even think that testosterone plays the major role in PCOS, and we can talk more about that. But we don't talk about DHEA, we don't talk about thyroid, cortisol, growth hormone. It's as if it's just estrogen and progesterone are declining while everything else is staying the same. So the thing to remember and to understand with perimenopause, that it's not just estrogen and progesterone that are ruling the show and sort of running the show. There's a host of other hormones, including growth hormone and thyroid and cortisol and testosterone and DHEA, that should be monitored.
Thank you so much for sharing that. I know my personal story is like I had things figured out, right? I felt like I really had Hashimoto's and the thyroid figured out until boom, perimenopause, like just said hello at 38. Yeah. And all of a sudden I'm waking up in the middle of the night with anxiety. I'm not sleeping through the night. I am somebody that used to be able to fall asleep anywhere. Like I was like, I was always such an amazing sleeper. People were jealous of me. And I was like, oh, you have insomnia. Yeah, I don't know what that's like, right? And so my sleep got impacted. I started to have PMS where I would get really irritable before my period. That I haven't gone through that since I was like a teenager, right?
Yeah.
Then I started having more frequent menstrual cycles, anxiety throughout the day. And then the crazy thing is my metabolism changed. So I was living in Boulder, Colorado, hiking every day, eating clean organic foods. And all of a sudden I was like, where did this extra weight come from? And
it wasn't muscle.
It was not muscle. It was, spoiler alert. all of a sudden, postpartum, I had my son around 35 and I was back to my like pre-pregnancy weight within 6 months. And I was always like, my family, my husband always teased me and said, your family is like a bunch of greyhounds, right? Like you just can't put on any weight, like no matter what you do. Yeah. And I would take weight gainer and of course thyroid hypothyroidism helped me out a little bit where I was able to eventually get to a healthier weight. But it was like, it seemed like it just happened overnight. Realistically, it was, a few months where I was like, wait a minute, my pants don't fit anymore.
Yeah.
What is happening? And it's interesting because I was looking through a lot of the symptoms I was having, and a lot of them actually fit with like growth hormone deficiency,
Yeah.
but nobody really talks about that.
Yeah.
And then I know you taught me something really interesting about progesterone receptors. Can you explain? Maybe we can go through some of the symptoms that happen and how the hormones interact with. I know for me, the progesterone and GABA connection was just such a, oh my gosh, that's a huge aha moment.
Definitely. So first, are you trying to say that it's not just calories in and calories out when it comes to our metabolism? And that's certainly a big component, right? We can't ignore what we eat and how much we move our bodies. But what a lot of women, especially in perimenopause, find is that, hey, I'm working out. I'm working out with a trainer. I'm counting my macros.
Yeah.
Why am I not seeing the change? Or I'm seeing an exacerbation in weight gain, right? And some of the other symptoms. So progesterone is one of the first hormones that really starts to decline. And there's a variety of reasons for that. Certainly sleepless nights, especially after we have our children, does not help. Stress, when we're trying to climb the corporate ladder, does not help as well.
2020 pandemic.
Oh, the pandemic did not help at
No.
all. It's like, why do we see more women entering perimenopause? Well, let's just see what happened over the last few years. But progesterone is really important for women. In fact, it's one of the hormones that I wish I could just sprinkle throughout the world because it would just make the world a better place. Progesterone helps us with sleep. It also helps to keep our menstrual cycle regular. It also, when we have optimal amounts of progesterone, it maintains our mood. So we feel more cool,
Chill.
calm, composed, chill. When we don't have enough progesterone, or especially in proportion to estrogen, which is a very important hormone, but it's a spicy hormone, and it can make us feel a little bit on edge. We love our estrogen, but we got to keep it in check. And that's what progesterone does. So the way that progesterone works is by stimulating the GABA receptors in the brain. Now, it's not progesterone directly, but it gets metabolized into allopregnanolone, which then stimulates the GABA receptors in the brain. And when we stimulate the GABA receptors the way that progesterone does, we feel chill. Our nervous system is calm. And we're able to achieve a deeper state of sleep. So one of the major signs of declining progesterone in our bodies is actual insomnia. But you brought up a really good point about growth hormone. Growth hormone declines by about 15% with every decade. And I like to even lead the conversation about when we're talking about metabolism and perimenopause with growth hormone. And I'm not talking about synthetic growth hormone because we want to avoid that. Synthetic growth hormone is not the same as sermorelin or ipamorelin or tesamorelin. A lot of these growth hormone releasing hormones and peptides that stimulate our natural ability to produce growth hormone. But especially for women, growth hormone is extremely important for maintaining optimal metabolism, muscle growth, bone density, sleep, collagen synthesis, repair, and I would go as far as to say that it can help produce a lot of the other sex hormones, including testosterone.
That's incredible. I feel like hardly anybody's talking about it, but everybody in their 30s and 40s, I have a lot of mom friends, and I remember we're all sitting around and talking about our kids and what's going on in our lives. And a few years ago, it was like everybody is anxious. We're all feeling so
Mm-hmm.
anxious. And some of the moms are taking CBD, some of them are drinking wine. I'm over here like taking GABA, right? And where progesterone could be really, really helpful for us, right?
Yeah. The thing is that hormones have so many other functions. It's like you can take GABA as an example and certainly can help you potentially achieve better sleep, right? And it can be calming to the nervous system. But progesterone is also cancer protective.
Yeah.
It keeps cells in check. It's anti-proliferative. And so I think one of the things that women struggle with is understanding when do we incorporate hormone replacement and how do we do it in the safest way possible? Because a lot of women have been burned
Yeah.
in conventional medicine, and a lot of women have been scared, unfortunately, into believing, and pretty forcefully, I might add, that hormones cause cancer. And this is why a lot of women, they go into menopause, postmenopause, and even perimenopause, they refuse hormone replacement as a possible solution because their mom was taking synthetic estrogen and synthetic progesterone, which is progestin, and potentially had cancer or developed a blood clot. And we know now, over the last few years, there's been so much data that has disputed the results that came with the Women's Health Initiative. But the damage was done.
Right.
And it's going to take a long time to undo that. And that's sort of what I've been doing. And even in our conversation today, it's helping women understand that it's not hormones that cause cancer. It is such a bigger conversation in terms of genetics and lifestyle and environmental toxin burden. And actually, that hormone imbalances can increase our likelihood of developing autoimmune conditions, cancer, metabolic disease. And so going back to taking something to help you sleep, it can help you sleep, which is really important because that can also help your hormones, but it doesn't solve potentially the low hormone levels that can contribute to metabolic disease and other things later down the road.
Yeah, I definitely feel like wine isn't the answer.
No. Yeah, it's definitely not. False sense of calmness.
Exactly. I know I was working in the pharmacy. I think I was still in pharmacy school, but I was working as a pharmacy intern where everybody was on hormone replacement therapy. If they were, of a certain age, we were dispensing a ton of hormone replacement therapy. And then that study came out, and all of a sudden it was like, okay, we're not, we're going to really be prepared for this because a lot of women are going to be stopping this. And we were recommending different therapies to counterbalance things. And then I learned about bioidentical hormones, right?
Yeah.
Can we talk about progestin versus progesterone? Are they the same? Is the synthetic progestin the same as a bioidentical progesterone, right?
Yeah. It's pretty wild that even if you just Google progestin, it's used interchangeably in a lot of literature with progesterone. It's pretty crazy that there's still so much information out there that uses and treats progestin and progesterone as one and the same. And they couldn't be any more different. And in fact, progestin, I would not even put it in the same category as progesterone because they do quite opposite things. Progesterone, the bioidentical progesterone, is equivalent in its chemical structure to our own progesterone that has been given to us by nature, right? Progestin is a synthetic analog of progesterone, but it doesn't do the same thing. So if we look at what progesterone does for women in terms of the soothing and the calming effect, it's great for our skin, it's great for our hair. It is great for our fertility. So in a lot of even fertility treatments, progesterone, the bioidentical progesterone, is prescribed because it boosts our fertility and it reduces our risk of miscarriage. Progestin actually increases our risk of cardiovascular disease. It does not have the same brain protective properties that progesterone does. And we know that from tons of research studies that have been published. We also know that progesterone actually improves and has our immune regulating properties. Progestin does not do that to the same extent as progesterone. And progesterone has been used actually in some studies to treat autoimmune conditions because it's an immune modulator. So synthetic progestin has been classically used to, let's say, prevent menstrual cycles or to suppress fibroids, or has been given for women with like endometriosis as an example. But if we think about the cause for those conditions in the first place, usually it's an imbalance between estrogen and progesterone. And in fact, if we improve that imbalance by even incorporating a hormone like progesterone, bioidentical progesterone that mimics our own progesterone, we can in fact really help women improve the quality of their life and reduce many of those symptoms.
That makes so much sense. And it's like the devil's in the details. I
Yeah.
remember learning about, we were dispensing a lot of Premarin at the time, and I remember learning that it's synthesized from pregnant horse urine,
Right.
and the name is like pregnant mare urine. It's kind of interesting.
Yeah. Well, just like there's progestin, there's also synthetic estrogen that is not bioidentical,
Yeah.
right? So conventional medicine is kind of stuck in this old school thinking because this is not something that they study. They kind of go with what they know in the past, and but they haven't read up on the last 10, 20 years of literature about what hormones do and in what form they should be prescribed. But just like there's synthetic progesterone, which is progestin, then we have the synthetic analog to estrogen. And actually, even the latest study showed that's not even synthetic estrogen that causes a lot of harm or trouble. It's actually the progestin paired with the synthetic estrogen, which was really surprising. But those are sort of the facts. I would say that the type of hormone that is prescribed makes a difference.
Yeah.
And I know that there's a lot of conventional healthcare providers who practice hormone replacement who would argue about using bioidentical hormones and would want women to use more of the conventional hormones like the estrogen patch or the progesterone prometrium as an example that's available conventionally. The problem is that those are usually prescribed in much higher doses than an average woman can tolerate, especially in maybe earlier or even later stages of perimenopause. So I'll give you an example. Prometrium, which is progesterone, the bioidentical conventional form of progesterone, the dose typically starts at 100 milligrams. Mm-hmm. When I was in my earlier stages of perimenopause, if I took that, I would be irritable, I would probably have acne, and I would not be a happy camper. Because hormones, it's all about balance. Like I frequently say balance is overrated in life, but when it comes to hormones, it's the one place in your life where you want them to be balanced or where you want to achieve balance. So for me, as an example, and for a lot of my clients in earlier perimenopause, we want to start on a lower dose of a hormone. We don't want to just oversaturate those receptors and cause negative side effects, because too much estrogen, not enough estrogen, or too much progesterone, not enough progesterone, and you can have really similar symptoms, right? It's like technically you're supposed to feel better, but I just gave you too much hormones. Now you feel worse. You kind of feel the same as you would be deficient. So bioidentical hormones, it's not just about being able to provide your body with equivalent to what your body produces. But when we use compounded bioidentical hormones, we can also incorporate one's sensitivities, right? If I'm sensitive to peanut oil, I don't want to be taking the conventional form of progesterone, which is again prometrium, because that may increase inflammation for me. And I've tried it and it causes joint pain for me. And I don't like it, and I lose hair with a conventional progesterone. There's also different formulations. Some women who have fibroids don't do well with oral form of progesterone. They do better with a topical cream form of progesterone. Some women need it intravaginally. So there's many different ways that we can play around with bioidentical hormones, especially in a compounded form.
I love that.
And you know this, of course.
I love compounded meds. I think it's just an amazing ability to tailor the dosage and the formulation, fillers. You can do all of that for a patient, where you can also make it easier for them to take a whole bunch of things at once, right? So you can compound a whole bunch of different hormones into one application form. So I personally am a big fan of it. I know it can be very controversial when the compounding pharmacies aren't doing their due diligence
Right.
and they're not using the right starter materials and they don't have quality checks. And so we
Correct.
have had issues like that. But for the most part, compounding pharmacies really do change lives and they can offer dosage forms that really are not available to
Right.
people. And I mean, from children to people who are highly sensitive to, I mean, just the average woman that might have a
Absolutely.
peanut allergy, peanut sensitivity, or just needs a tailored dosage for herself. Like we don't necessarily want horse amounts of hormones in our
We
system,
don't.
right?
We don't do well with that.
Yeah. Yeah,
But
that's where I was going with this. I was going for like estrogen and like horse dosing versus just what we need as women, as human women, and at different stages of perimenopause. When we're starting off, we don't need as much progesterone. And then things might flip as well, because as we progress with perimenopause, we might actually need some estrogen, right?
Absolutely. And that becomes a big player mostly in the later stages of perimenopause when it's not just progesterone that we start to supplement with, it's estrogen and testosterone. So in my early 30s, I mostly needed thyroid because, like you, I've blessed with Hashimoto's. You
Yes.
know, we've learned so much about our bodies via our personal experience. But in earlier stages of perimenopause, I just needed thyroid and progesterone.
Mm-hmm.
Then, as I was getting closer to 40, I noticed that, wait a second, why do I need to motivate myself to go to the gym? I mean, I'm an athlete. I don't need motivation. If I wasn't a doctor, I'd want to be like a professional tennis player, right? Something to do with sports. So I don't need the motivation. But I noticed as I was approaching 40, I was like, wow, it's a little bit more effort. And I know a lot of women are like, well, wait until you're older,
Yeah.
trying to prevent that. So I start to incorporate more testosterone
I could relate. I
into
could
the
relate.
mix. And it's amazing the impact that testosterone has on the female brain, on our psyche, on our motivation, on our libido. It is a really important hormone for us. So as we go through perimenopause, it's really important to consider um, testing a bit more frequently and not just once a year, maybe even once a quarter, maybe once every 6 months, depending on the cadence that someone has with their physician and what sort of different protocols they try, because your treatment plan and the tools that you use will evolve and will change depending on the stage of life. You mentioned receptors. And it's one of the things that as we get older, it's not just the quantity of any given hormone that we start to incorporate, our ability to receive that hormone. So everything from receptor sensitivity to the quantity of receptors that we have that are available and active also starts to decline, which is why even for women in postmenopause, and I work with women from perimenopause to postmenopause, all stages of life, once we dial the dose, we sometimes have to change it because we're still continuing to have some decline in those hormones. And of course, there are also changes in the receptors, the actual cell receptors that receive the hormone, that we're seeing changes.
I do want to ask you because I know people are watching and listening and thinking of like, am I going to be like a bearded woman with, you know, Arnold Schwarzenegger sized muscles if I take testosterone? Can we really get into that? Because I feel like women have a fear of testosterone because
Yeah,
when you give it, you typically think of it as a man's hormone, right? But women actually, we also make testosterone. Can we get into
absolutely.
that and how much we should maybe take versus what a bodybuilder might be taking illegally? Like that, there's a huge
Yeah.
world of a difference there, right?
Yeah, absolutely. So you're not going to turn into Arnold. You would have to do a lot of different things to turn into Arnold, including taking testosterone, growth hormone, peptides, other steroids, and 6 hours at the gym, if not more. Right. So there's a lot more to it than just testosterone. But the area where we get into trouble with testosterone is just when and this can happen with any hormone, is when we prescribe too much too soon, too quickly. And I'll just give you an example. If I have a male patient who doesn't want to do injectable, doesn't want to do testosterone pellets, he really just wants to ease into testosterone therapy, the starting dose is around 60 milligrams
Hmm.
for a male. Frequently, we see physicians and other healthcare providers prescribe testosterone to women at around 4 milligrams.
Okay.
So there's a very big difference, right? For women, testosterone, if we compare apples to apples, because testosterone is measured in a specific measuring unit on the labs, and then estradiol has different unit of measurement that is used. If we compare apple to apples and measure testosterone and estrogen in the same measuring units, women actually proportionally have more testosterone compared to estrogen.
Wow.
So our bodies are actually designed to handle quite a bit of testosterone. So it may look like your maybe estradiol is at a 150 and testosterone is at a 30. And you're like, but wait a second, my estradiol looks higher than testosterone. But if you actually convert it to the same measuring units, you'll see that proportionally you may actually have more testosterone compared to estradiol. So the key with testosterone to prevent the negative side effects like acne or chin hairs, there's a few tricks to this because we want to keep the positive benefits, but make sure that we don't get the negative side effects, is just to start low and go slow. So this is where sometimes I will start women not on 4 milligrams of testosterone because that's too high. And I'm surprised that a lot of healthcare providers start women that high, but 0.5 milligrams and see how it's tolerated, or maybe 1 milligram of a testosterone cream. If we want to take the safest route, I usually don't recommend testosterone in an injectable form. I rarely recommend testosterone pellets, and I know that it's really hard to find sort of medium ground. You're either against it or you're for it. And I find that I'm never against really any therapy. I think like there's a time and a place for all of these tools and resources. And I would say that I have a small percentage of women that actually do very well with testosterone pellets, as an example. A very small percentage of women who actually do well with testosterone injectables, but it's not the first place where they started. Because if you take a woman who's been depleted from testosterone over the years and you saturate those receptors with a bunch of testosterone, whether it's from a pellet form or injectable form, of course, we risk getting those negative side effects like irritability, mood swings, chin hairs, acne. I wish one of the negative side effects was, Arnold-like arms, which wouldn't be a bad thing. But unfortunately, we get all the other stuff, but not really the muscle building aspect of it. So testosterone is important for bone mass, for brain health, mood, motivation, libido. Of course, it's important for muscle mass. But just supplementing with testosterone replacement is not going to make your muscles grow. You actually have to put in a lot of work and lift those weights and throw heavier weights around in order to see some of those body composition changes. The other thing I will add is there are many ways that we can manage some of the negative side effects of testosterone therapy. So if someone does really have significant 5-alpha reductase activity and they're just metabolize their testosterone to estradiol or DHT, things like nettle root, saw palmetto, and in some cases even spironolactone in small doses can be helpful. So that way you get the benefits minus the negative side effects of testosterone.
Thank you so much for sharing that. And thank you for sharing about pellets. And for everybody listening, pellets are essentially implants that secrete hormones into your body. And, as a pharmacist, I agree with you. You want to start low and go slow. And I get nervous with pellets. I feel like a lot of physicians who just like start working with hormones, that's like their go-to because it sort of makes it quote unquote easy, but then you risk of really overdosing somebody. And then there's, there's so many different factors that could cause them to have uneven secretion too.
Right.
So I feel like I'm with you on that maybe that's not the safest place to start. And eventually, maybe if you're very stable, you can get to something like that. But start low and go slow. And then you have a lot of tools that people can utilize if they do feel like they're overdosed or they're getting that chin hair. Okay, speaking of chin hair, DHEA. This is another one of my favorites.
Yes.
This is something that declines. It's also known as our anti-aging hormone.
Right.
Can you speak to that? a
Yeah.
little bit more how
Yeah.
you utilize DHEA.
Yeah.
I know in some cases, women who maybe are trying to conceive, DHEA might be recommended versus testosterone. How do you utilize these in your practice?
I may be one of those physicians that actually does not quite like DHEA.
Yeah.
And it just really comes from just professional experience. I've worked with so many women and so many men over well over a decade. And I've never quite seen benefits with DHEA. And I wish I could say the positive things that I've read about it, that I've heard about it, but I haven't seen it in my practice. Now, of course, I may be attracting certain demographic into my practice. So I'm not saying don't take it or that it doesn't work. It's just that I haven't seen the miracles that it should create or that it's responsible for. DHEA is also technically supposed to be really good for our sleep because when DHEA is low, our cortisol can be left unchecked and can kind of peak.
Mhm.
So that second wind at night can actually be modulated by DHEA. So if we tend to be low on DHEA, then we can, by taking it in the evening, it can help bring down cortisol. I have not seen that, but maybe other people and other healthcare providers have had a different experience. DHEA, some of the DHEA is known to be converted to testosterone. Most of the time I see DHEA when supplemented, it gets converted to estrogen, estradiol, unfortunately. Our bodies just love estrogen. And again, there's a lot of reasons to love estrogen, but that is one of the unfortunate things is DHEA, although technically some of it can be converted to testosterone, a lot of it ends up going down the estrogen pathway. So the other thing is DHEA gets converted to 7-keto, right? DHEA. And that is supposed to be, technically, it's not supposed to have those anabolic
Mhm.
side effects like DHEA has, like the chin hairs and the hair loss or the mustache or the acne. It's supposed to have more of the positive benefits of
Mhm.
DHEA, like on the libido, energy front, metabolism. I have not seen that personally, right? And from professional experience. But some people do claim that it does help them sort of have the benefits of DHEA without the anabolic side effects. I do see it help. Actually, now that we're talking about this and I'm thinking about my population, my patient database, I do see it have better effect in my older population group. So like 60s, 70s, when we're starting to struggle with energy, there's a little bit more fatigue. It's just not enough to have testosterone or some of these other hormones or even growth hormone peptide. So I do see that it can even increase VO2 max and endurance and aerobic capacity. So I have seen some benefits, but more in my older population group.
Interesting. I've used it quite a bit initially when I used to work with people with adrenals and we
Yeah.
would do their adrenal testing.
Yeah.
And I found you had to really microdose it. So
Yes,
the doses of like 25 to 75 were just too much for some people.
absolutely.
And some people would even like 1 milligram or 2 or 3 milligrams, that would even be too much for them. It would
Yeah.
just over convert to DHT. One hack that I found is actually topical magnesium, especially if you could
Oh,
soak in an Epsom salt bath. Sometimes I would see DHEA levels improve
oh
on
wow.
people's lab tests just through utilizing that. And I don't know if this is a younger population, perhaps in somebody that's 60, 70 plus, that might not work. But now I'm sort of at this point where I'm like, okay, if you have some adrenal dysfunction, why not try magnesium first
Right.
and see if that helps versus going, into the DHEA. Although I feel like there's still a lot of people that may benefit from that. But for me, it's
Absolutely.
kind of like chin hairs
Well,
first.
that's sort of the thing that I've seen. I'm a conservative DHA prescriber, so I don't start above 5 milligrams,
Yeah.
right? And I've even seen at 5 milligrams that my patients start complaining of hair loss. They're
Yeah.
growing a mustache, there's acne, and there's chin hair. And I'm like, that's just 5 milligrams.
Yep.
And when we test them, we actually don't even see that huge of a bump in DHEA. And so But again, that's just my experience. And it's, you have to go with what your healthcare provider recommends and what works for, right, your body, because we have different sensitivities and we have different preferences for how we choose to convert different things in our bodies. So don't let that stop you from using DHEA. And you bring up actually a really good point about the role of the adrenal gland. And sometimes this can become tricky when we're looking to find out, so is this perimenopause and am I about to enter this stage of my life, or is it something else? Because we don't want to confuse hypothyroid with perimenopause or adrenal dysfunction with perimenopause. So if we have someone, let's say Sally's a 35-year-old female. She comes in and she's experiencing insomnia, fatigue, a little bit of weight gain. And she's concerned because she listened to our podcast that she may be in perimenopause. We find out that she's eating a lot of fast food. She's living a sedentary lifestyle. She doesn't remember the last time she was at the gym. And she's got 2 or 3, let's say, young kiddos, right? So she's tired. She's eating the standard American diet. She's not really moving her body. She's not sleeping. Is it because of perimenopause, or is it because we need to make sure that we improve her diet, her lifestyle, her gut health, and improve her circadian rhythm? Sally comes back 6 months later feeling brand new. She no longer has PMS symptoms, mood swings, her libido is back on track, her energy is blooming. So was it perimenopause or was it something else? So a lot of those things, our diet can impact our adrenal health. Our stress management or lack of it can impact our adrenal health. And our adrenal gland is not just cortisol production, and it's not just DHEA. Our adrenal glands produce sex hormones. So especially for women, it can, if we're doing something that is taxing our adrenals over and over, because your adrenal gland sort of has a choice to make. Are we going to survive cortisol, or are we going to reproduce sex hormones? It's hard to do both. It's hard to run away from the tiger and reproduce at the same time, right? So when we're working, especially with potentially earlier stages of perimenopause or women in their 30s, it's really important to address the foundation and see if things improve, because those declining hormones could potentially be reversed if we address the lifestyle piece, the thyroid, and the adrenal conditions.
What do you think of the pregnenolone steal? I know it can be quite controversial where some practitioners are like, this is absolutely what happens. And then others are like, no, that's not a thing. I want to know your thoughts on that. It's like the theory that pregnenolone gets shunted away from hormone production when we're under a lot of stress.
Yeah, that is the $1 million question, isn't it? Because there's so much debate around it.
Yeah.
Honestly, depends. Right? I think the reason why these theories are around there is because some of us who do a lot of testing, whether it's urine testing or serum testing, we see what happens to pregnenolone and we see what happens to progesterone and cortisol under stress, where one goes up, the other ones go down. And we see what happens when we improve cortisol production. And by that, I mean, we are able to better regulate cortisol production. And we may be able to see via lab testing, your urine testing, that then progesterone and pregnenolone normalize. But can you replicate that? And can you see that continuously from patient to patient, from person to person? And so my feelings are mixed about it, right? Just like with DHEA, it's like sometimes it's true, sometimes it isn't true. So I'm kind of on the fence where I could go either way with that theory, just because I think when if we're uncertain about something, and it becomes a matter of we have to look at it from individual to individual, where in some situations that might happen, in others it might not.
Yeah, and I think it could be like age dependent too, right?
Right.
So
Yeah.
absolutely, if you're super young and you're under a lot of stress, that could be an issue. But if you're 50 years old, there's probably
Yeah.
more of a hormonal change
Yeah.
happening versus, I mean, they're all hormones. There's more of a
Yeah.
female hormone change. And it's just interesting because all of our hormones work together in symphony and they can absolutely influence each other. So women that have an easier time in perimenopause, oftentimes their adrenals are going to be more balanced, right?
Yeah.
And then there are women who maybe have had their thyroid hormones balanced myself as an example, super balanced, and then perimenopause can actually throw that thyroid hormone balance off. Can we talk through some of that mechanism of what happens when we get into perimenopause and our hormones start to shift, how that impacts our thyroid hormones?
Yeah. So it is sort of a chicken or the egg kind of question
Yeah.
because thyroid affects ovarian function.
Mm-hmm.
And of course, we produce estrogen, progesterone, some testosterone in the ovaries. So if our thyroid function starts to decline, and that impacts our ovarian function and our even potentially ability to produce, let's say, estrogen and progesterone, then we can start to experience some symptoms of the perimenopause. But we also know that declining hormone levels can affect thyroid function.
Yeah.
So unless someone, and this is why I encourage women to start looking into their and getting their hormones tested earlier in life, unless we're able to track some of these changes. Let's say someone does a hormone panel in their 30s, right? Let's say they turn 30, they want to they want to test their hormones, and they see that maybe the thyroid is struggling a little bit, right? But all the other hormones are fine. That is something to note because if then the woman goes and tests her hormones 5 years later, maybe she had a couple kids on the way to 35, and her thyroid tanked even more, but then there's potentially sex hormone changes. Then we know that the thyroid changes preceded, right, the sex hormone changes. So there's a couple ways to differentiate what came first, right? Was it the thyroid tanking and then the sex hormones followed, or was it the sex hormones and then the thyroid followed? But that's one of the ways that we can differentiate between the two. And then, of course, it also depends on what symptoms came first. If someone is struggling with classic thyroid-like symptoms like hair loss and dry skin and fatigue, I would say even frequency of getting colds and flus and getting sick in general, that's a really big sign of a thyroid dysfunction because when we correct that, people don't get sick once a month, even before their cycle. You can start to see which symptoms were leading the way, and you can kind of differentiate it. Was it the thyroid or was it the other hormones?
But it's important to test because you might be thinking it's one hormone where actually a few different things can be out of balance, and you
Right.
might need to correct not just the adrenals,
Right.
not just the thyroid, and
Yeah.
not just the female hormones, but you might need to address all three
Yeah.
in some cases. Not in every case, but that's why
Because
testing is so important, right?
because of the overlap.
Yeah.
Yeah, the overlap, there are some things that I heard someone say, of course, on Instagram, where we get our information
All of it
nowadays.
now. All of it these days, right?
If it's not on Instagram, it's not real. I'm joking when I say that. But I heard someone say that in perimenopause, if a woman is very irritated or aggravated or is moody, that it's a sign of an estrogen deficiency or imbalance. And I would disagree because in perimenopause, it's really led by higher estrogen and lower progesterone.
Also, your husband's breathing.
The husband's breathing, yes, and snoring and, children headbutting you in the middle of the night can also contribute to that. So we have to, but, as we're getting older, yes, certainly declining estrogen levels can make women moody and can contribute to memory loss and can contribute to brain fog. So is it the progesterone or is it the estrogen? Most of the times we get older, it's a combination. It's not just one or the other.
Makes a lot of sense. So typically, you hit at a certain age, maybe your 30s, your 40s, you notice that your metabolism changes. And what do? You go see Dr. Google, and Dr. Google says, well, seems like you need to exercise more,
Eat less.
eat less. Can we talk about how some of these extremes might be ruining women's hormones and metabolisms?
Yeah, I think women become pretty desperate
Yeah.
to have an answer or to feel their best confident self like they used to. And it's probably the number one complaint that I hear, whether I'm on the soccer sidelines talking to the soccer moms, or I'm on Instagram or on a podcast or talking to my patients. Why is it that I used to eat X and get Y results, and now I eat the same way, I work out the same way, but I'm not seeing the same results? And between the carnivore diet or the keto diet, the paleo, the Whole 30, a lot of women find themselves that for 1 month they do the carnivore and then they don't see the results. They go to the keto and they don't see the results, or maybe they see the results, but it's not sustainable. They jump to paleo and then they gain the weight and they go into a caloric deficit. And now we've totally confused our body about what we're trying to do. So are we trying to lose fat, build muscle, lose weight, cut calories? Are we putting ourselves on starvation mode? When's the next meal coming? And exercise can be a positive stress. Exercise can be also a negative stress, right? Putting ourselves into a caloric deficit is a negative stress. And a lot of the conversation nowadays, and it's really hard to convince these people, the PhDs of nutrition and exercise science, that for women in perimenopause, it's not just calories in and calories out. And certainly, yes, if we are in a caloric deficit, we can lose weight. But should we be in a perpetual caloric deficit? Because that's not sustainable, and that's a sure path to stressing ourselves out and finding ourselves gaining more weight over time. So hormones play a big piece to our metabolism, and it can be where hormones affect our mood, and then we're starting to gravitate toward making potentially other food choices, like craving more sugary foods, more salty foods. It can be where we're starting to have symptoms like we have, not as good portion control. As an example, actually, growth hormone helps with that, even with feeling of fullness, as an example, and insulin regulation and glucagon regulation. So as our hormones change, it can control our appetite. It can contribute to insulin resistance, and it can also contribute to a reduction in muscle mass. And muscle, because it's actually an endocrine organ technically, because we produce all of those wonderful growth factors that muscle produces when we exercise, but it's also one of the biggest glucose uptakers. So now when you're slowly, maybe it's because of a decrease in testosterone or decrease in growth hormone, now that you're potentially losing some of this muscle mass percentage, you are losing a very important metabolic sort of tissue that helped to keep your metabolism going, maybe in your 20s or earlier in life.
Yeah, I mean, it just makes so much sense. I mean, we know that thyroid hormone manages our metabolism,
Yes.
muscle manages our metabolism, and the things that 25-year-old influencers do are not necessarily going to work so well for women when they're
Yeah.
35, 45, 55,
Yeah.
because we have different bodies. We
Right.
have different makeups of our bodies. And so we really have to change up our routine.
Yeah.
One, when we get to be, more in the perimenopause age, I know for myself, it's been a lot more muscle building and a big focus
Yeah.
on that. So a lot of times we need to do things differently than we did in our 20s, and we need to
Yes.
really focus on muscle building. And I know I have like a walking treadmill in my office these days, and I have a weighted vest, and I have
Yeah.
some weights at home that I do a lot more of that than I really needed to do in my 20s
Yeah.
to really stay at a healthy weight. But we have other tools in our tool belts that you've been working with for quite some time.
Mm-hmm.
Weight loss peptides. I
Mm.
know some women are very scared of them, but
Mm.
there's, just like as with everything, the devil's in the details. And
Yeah.
there are correct ways that we can utilize them so that we're not losing muscle mass, right? So we're
Yeah.
getting the right method to utilizing them. Can you share more about weight loss peptides, how you use them, and some things to consider?
Yeah, absolutely. And I'm sure in the future we could just dedicate a whole conversation
Yeah.
to just peptides in perimenopause and all the different things that they do. But of course, hormones are so important. And even before considering something like even weight loss peptides or muscle building peptides, we have to establish a foundation. And I think this is where, again, something that is so beneficial as semaglutide or tirzepatide and some of the other weight loss peptides, they've just been misused and they've not been introduced properly or in the right order. So if someone has thyroid issues, if the thyroid issues don't get addressed and you put someone on a weight loss peptide, they're not going to get the same benefits as someone who is also working on, of course, the dietary and lifestyle piece and is working with an exercise coach. on actively building muscle, on actively making sure that they get X amount of protein in the day that's right for them. And when you have a properly functioning thyroid and maybe you are on hormone replacement or you're not, but you're working on improving your hormones, you're always going to have the best outcomes with these therapies. And I have to say that I don't like the word weight loss, and it's because, and I even struggled with how do I teach women about some of these weight loss peptides, right? Because we're looking to improve overall our metabolic health. So when we're talking about even weight loss, what are these peptides supposed to do? They're not just supposed to suppress your appetite. They're not just supposed to make you skip meals. They are there to help you regulate your blood sugar, your insulin. They're there to help you build muscle when used appropriately, right? They are there to actually stimulate some of those receptors like GLP-1s that are no different than the hormone receptors that we lose as we age. So when people get irritated or frustrated that they think that this is a way to cheat the system, it's like, no, 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 no. It's no different than we're supporting our thyroid with thyroid hormone because we can't produce T3 or T4 on our own. It's no different than supporting our growth hormone levels with some growth hormone peptides because we're not producing it on our own in the same levels like we used to. Same thing with semaglutide, tirzepatide, retatrutide, some of these other peptides. We've got a whole arsenal of them, depending on the patient and what their needs are. They're supposed to be used to help women improve their metabolism by improving their blood sugar control, improving their insulin secretion, and ability to actually utilize glucose. In some cases, can help break down stubborn fat cells, right, that we can't get rid of. And when we pair it with peptides like growth hormone releasing hormones like sermorelin and CJC and ipamorelin, it's this magic combination that helps us not just lose the fats, the stubborn fats that is jeopardizing our health, but build the powerhouse endocrine tissue, the muscle mass that can help us prevent the weight gain in the future.
Yeah, it's interesting. I've had some clients and friends, and I've tried a dose myself. And one of the things that people say is it takes the edge off,
Right.
that you use these peptides and you
Mm-hmm.
just feel differently. So there are also benefits beyond weight loss. What people
Absolutely.
are finding. Can you talk more about some of the
Yeah.
benefits you're seeing? Perhaps autoimmune markers?
Yeah. Absolutely. And I think this is where the focus should be because a lot of women even in perimenopause or with the hormonal changes or even without being in perimenopause or having any hormonal changes. I mean, it's not just these peptides are not just meant for those folks, but these peptides, if we think about at the root cause of disease and even metabolic dysfunction, it's poor glucose metabolism and utilization of glucose. And it comes down to our body's ability to regulate mitochondrial function and mitochondrial activity. And a lot of these receptors, like even GLP-1s, they're located throughout the body. It's not just like our intestines or pancreas. It's not just insulin secretion. So when we incorporate these peptides for weight loss purposes as an example, but if we prescribe them not for weight loss purpose in microdoses for blood sugar control, we also regulate our immune system and our inflammation because we know that when sugar is out of control, or blood sugar is out of control, or insulin is out of control for whatever reason, it can be pro-inflammatory. Or you could have normal blood sugar, normal insulin, but you are struggling to properly utilize glucose and utilize glucose for energy as an example, right? Because everything at the end of the day, everything gets broken down to what?
Mhm.
Glucose. So what we find is that a lot of times these weight loss peptides, and I've seen this in my private practice, I've seen this in practices of other professionals, is that we see better inflammation control. And with that, we see improvement in cognitive function. We see improvement in mood, especially with women with PMS or any other mood disorders. And we see a reduction in autoimmune symptoms. So it's pretty miraculous in what we can achieve with these peptides. And that's how I use them in my practice. I have women who come to me because they want to not just lose weight, but they want to be in the best shape of their life.
Yeah.
And they also have hormone imbalances. And we start them by making sure that we're eating right, moving our bodies, making sure that we're sleeping well. We work on balancing their hormones. And concurrently, we introduce one of the GLP-1 or GAP agonists, like semaglutide or tirzepatide. And I have women who don't have any trouble with their weight, but they've got some skin issues, or they have an autoimmune component that they want to get under control. And we use it that way, and we dose it below the recommended starting dose for these peptides. So there are many different uses to them, and unfortunately, celebrities tend to ruin good medicine for us.
They always do that, don't they?
It's sort of like, I had a patient who was it was life-changing for her. And most of my patients who come to me, they're such hard workers. Like, they are the ones who will follow any plan to the T. Like, they'll follow their macros. They'll work with their nutrition and exercise coaches for years without seeing results. And they're miserable because they feel like it's a constant battle with their mind. I want that cookie. I don't want that cookie.
Yeah.
Right? And they have the cookie. There's the guilt about having the cookie. And certainly when they do end up being on semaglutide, it's a liberating experience to where that cookie is no longer running the show in their mind. But anyways, I have a lot of patients who work really hard. And when we introduce this into the mix, it is absolutely life-changing for them.
Yeah, it's fascinating. I know Oprah had said, I want to say it was Oprah, that she thought thin people just had willpower. And it turned out they just didn't have those kind of cravings. And I
Right.
think that could be really eye-opening for a lot of people who maybe struggle with their will. They feel like they're struggling with their willpower, whether that's for, having some wine or having that cookie or whatnot. I know I've had a lot of friends and clients say, like, my willpower is so much better when I utilize this. And then, of course, there's like the Ozempic babies, right? So women
Yeah.
who were not able to get pregnant, maybe PCOS was the root cause of that. They're having children spontaneously.
The past couple of years, we've seen a lot of Ozempic babies in our practice. In fact, we just got another confirmation yesterday. So it's very exciting, and you and I have even talked about different peptides and compounds like rapamycin
Mm-hmm.
and its impact on ovarian health and its anti-aging properties. And I've honestly seen more benefits on fertility from semaglutide, especially with women who potentially have had a history of PCOS, than rapamycin.
It's incredible.
At least in immediate, right, results. Now, it could be different depending on the age, of course. A lot of these women are in their 30s who've had really great results. And potentially we need to have more data, right, on rapamycin to fully understand the benefits it can have on fertility and the impact. But I definitely have a pool of patients who are on rapamycin and a pool of patients who are on semaglutide. And so far, semaglutide is leading in terms of the fertility outcomes.
Interesting. And for everybody listening, so rapamycin is one of these repurposed medications that might have some benefits for ovarian aging. So some people are utilizing it to delay perimenopause, delay menopause. Some people are utilizing it for premature ovarian failure or premature ovarian insufficiency. And this is where my interest has been, is premature ovarian insufficiency, because
Yeah.
this is something that I've had and that
Yeah.
I'm currently investigating. So thank you so
Yeah.
much for sharing that. It's one of those experimental therapies
Mhm.
that I feel like we're just learning a lot more about. But it's exciting to see that you're seeing these incredible results with semaglutide.
Yeah. And it's about how the therapy is used.
Yeah.
You can overprescribe any therapy. You can drink too much water and die, right? It's the dose. What is
Yep.
it? The poison is in the dose, or what that saying is like. So I find that the way that I like to introduce the weight loss peptides is I love to pair them with the growth hormone peptides. And these peptides have been around for a very long time. They've been heavily researched. And what I find, especially when we introduce the growth hormone peptide, we start to solve this metabolic problem that women experience in perimenopause, which is what you and I were talking about. To look back to that, what happens to our metabolism and the reason that it slows down, besides the hormonal component that potentially drives the loss of the muscle mass and the bone density, this is where the growth hormone peptide can help us. It can help us to rebuild the muscle mass. It can make us more metabolically efficient. So when you pair that together with semaglutide, it can be a magic combination for women to start reversing some of those metabolic issues that we start to experience with hormonal changes.
It's incredible. So you have this two peptide combination that you love to use in women with perimenopause to really support their metabolism and their recovery. And growth hormone peptides can essentially help us release our own growth hormone. So it's
Right.
not synthetic,
hmm
and then can help us release our own internal hormones, which is amazing because who doesn't want that versus taking something externally?
The one thing I would add, though, we're not trying to prevent menopause from happening,
Yeah.
right? I think it's normal to want to not have such turbulent waters leading up to menopause. And that's what really I try to do. I'm not trying to get someone to be 20, even though some of my patients laugh. They're like, I really don't mind.
Yeah.
But it's not really my job to do that. It's like menopause will still happen and it might happen when you're 55 or 57 or 50. But it's really my job to make sure that we just make it as smooth and comfortable experience as possible and improve the health span because we're living longer. If we look at 100 years ago, a woman was lucky to enter menopause. I mean, we were lucky to experience a hot flash in the 1920s. 1950, an average lifespan for a woman was 72.
Wow.
Now, 2025, I should say 2024 because 2025 just started, but the average lifespan for a woman is 80. So, thanks to medicine and a lot of progressive interventions, including emergency medicine, and our ability to bring people back to life and to prevent people from dying, we are living longer. But our health span, hasn't caught up yet. And so this is what we're able to do with hormones. It's not that we're just, it's not that we want, women to have cycles up until they're 70. And I know a lot of women are like, I don't
Yeah.
want that. I want to be over with that. But we just want women to feel like they're vibrant, healthy selves for as long as possible. And that's what these peptides and that's what hormone replacement is able to gift us.
I love that. And it's just like all about thriving and how do we
Right.
be our healthiest selves,
Yeah.
not try to, stop something that's going to happen, right?
Right. hmm
We talked about GLP-1s, we talked about sermorelin. Can you share a few other peptides that you like to utilize and maybe give us a little bit of a sneak peek as to why you might want to utilize them?
Yeah. So what I personally love and professionally because I've seen so many benefits with this. Some of the things that women, of course, struggle with in perimenopause and beyond is ADD, ADHD like symptoms.
Yes. Yes.
So again, is it thyroid related? Is it hormone related? Of course, because hormones we know affects our brain density, affects neurotransmitter production. It's very important to address the underlying hormone imbalances. But the brain fog and the focus issue is real. So I laugh sometimes like, oh my gosh, where did I put my phone? Where did I put my keys? But that's actually a really big red flag, especially as we get older. And so in order to help prevent dementia, in order to support the proper function of our neurons and overall brain health, and to improve how quickly neurons fire and transmit information between each other, one of my favorites is dihexapeptide. So it's been around for quite some time. Also, a lot of great research behind it, especially in the field of ADD, ADHD, and actually Alzheimer's, dementia, and Parkinson's disease, because attention is usually linked to lack of proper dopamine function or production. And so what dihexa does is actually protects neurons, especially the dopaminergic neurons that help to produce dopamine, but it also can undo some of the damage that potentially we've experienced, maybe with concussion or with sports or with trauma. So,
Incredible.
yeah, so Dihexa is one of my favorites, and it used to be only available by prescription. Now it's available in an oral capsule form that people can order, hopefully from reputable places. I love New BioAge. This is a brand that we use and that we carry. Most people notice benefits around 10 milligrams. Of course, always talk to your doctor before starting any therapy, but 10 to 20 milligrams of Dihexa has been shown to improve cognitive function. What mom does not want her cognitive function improved? And I actually noticed a huge difference the other day. I was out of it. I noticed I was out of it and hadn't taken it for a couple of weeks. And I literally freaked out because I was like, oh my God, I noticed the difference in terms of how sharp I am or not when I take it. So Dihexa is one of my favorites. And some peptides like semaglutide, growth hormone peptides, they are best when they're prescribed and offered through compounding pharmacy, because we'll make sure people are getting pure form of these peptides, not research peptides. But things like Dihexa, because they're available in an oral form and they don't need to be in a sterile compounded setting, that's fine. My other favorite peptide for women actually is oxytocin. Whether in a nasal spray form or in a troche, which is like a dissolvable like gummy form, I find oxytocin is very soothing to our nervous system. So of course it's the bonding hormone.
I
So
love hormone.
yes, our love hormone. So this is what we experience when we're intimate. This is what we experience when we are birthing our children. This is what we experience when we're happy in a community, when we're giving a hug to someone. But sometimes our own oxytocin production actually declines with age too. Again, I'm kind of going back to, it's not just this estrogen and progesterone decline that happens. Like a lot of the other hormones and peptides that we naturally produce start to decline. So oxytocin can help with libido. It can help us feel more calm and cool. And oxytocin actually can help us regulate our blood sugar and our appetite as well. So I find that this one is really easy to incorporate and to use. From an inflammation and autoimmune perspective, I actually love anything that is thymosin gland based. So a little known fact about our thymosin gland, which is, it's not really in the spotlight. No one really
Yeah,
talks
nobody
about,
talks
it's
about
not a
that.
sexy subject. Like, let's talk about our thymus gland. Did I say thymosin? Our thymus gland. So it is in, it regulates our immune system. So it produces actually, like our body naturally produces tons of peptides. And just like we can supplement with progesterone, we can supplement with some of the thymus-derived peptides, like thymogen alpha 1, thymosin beta 4. And what's an interesting fact is that people with autoimmune conditions, including Hashimoto's or rheumatoid arthritis, I'm like, which one do I want to say? Because there's so many that all want to come out at once, or even SLE, lupus. What's been shown is that they actually, folks with those autoimmune conditions, they have lower amounts of thymogen alpha 1 peptide in circulation. And as much as negative rep that a lot of autoimmune medications get, they actually boost thymogen alpha 1 levels in the bloodstream. But to get rid of the negative side effects that autoimmune medications come with, we can actually supplement with thymogen alpha 1 peptide to help reduce inflammation. And I've seen some amazing things happen with antibodies go down. Hashimoto's antibodies can go down. Thyroglobulin antibodies can go down. RA antibodies can go down. So, and it's not just that one thing that we're prescribing. Of course, a lot of times patients are also on low-dose naltrexone. They're on hormone replacement. But overall, it can be the missing piece to the puzzle.
Fascinating.
So those are some of my favorites.
I love that. Thank you for sharing about those, because I think hardly any people talk about them, and there's so many people that could benefit from this information.
Yeah, absolutely. I see peptides as the cherry on top of everything else that we do. It's one of those things, sometimes people want to jump a few steps and skip the diet, the exercise, the hormone piece, and go straight to the peptides. I don't blame them. I love peptides. In fact, that's one of the things that I incorporate in my day to day. But peptides are really important to incorporate in the context of everything else. But they are sort of a key sometimes that when you use them appropriately, it makes everything else work accordingly.
Incredible. And is there like an age limit? Do you have to be a woman of a certain age to benefit from hormones or peptides? What are you finding?
It depends on what the people are experiencing. So if someone is naturally not producing enough hormones in their 20s, absolutely. We can start them on hormone replacement at much younger ages. It really depends on the cause, right, for their inability to produce certain hormones. But I have women in their 20s who are starting on hormone replacement and women in their 30s, of course. That's an average age when we're starting to see women starting to utilize some of the hormone replacement therapies. But when it comes to peptides, it's really you can incorporate them at any point in time.
Yeah, I feel like even pediatricians are starting to utilize them
Yeah,
with children and seeing some benefits.
yeah.
So, before we jump into some fun rapid fire questions, I was hoping you could tell people a little bit more about where to find you and about this incredible, amazing guide that you've created for all of us.
Thank you so much. So you can find me on Instagram at Dr. Elena Zinkov. I have a lot of fun on there. I love to post about what I know and talk about peptides and hormones and everything in between, including mom life. But if people want to learn more about peptides, especially weight loss peptides, muscle building peptides, and some of the things to avoid, to look for, how to combine them, we have a free guide on our website. And you can go to proactivehealthnd.com. We also have our website, perivive.com, where people can get this free guide.
Fantastic. Thank you so much for providing that for us. We'll put that in
Mhm,
the show notes.
mhm.
Okay. Rapid fire questions. What's one wellness hack that you refuse to participate in?
I would have to say drinking olive oil.
Olive oil. I don't think I've heard of that before.
Yeah, well, one of our friends has posted about drinking olive oil. And we have very unique friends in our community, but it's something that I actually heard about a long time ago. And actually when I was 16, as I was thinking about it, when I was 16, I had a family member who convinced me somehow to drink olive oil for its detox liver benefit properties, which I don't recommend it. Um, I don't know how much research is really behind that on its benefits, but it's one of the things that I've seen people do, as in like drinking olive oil to bind up toxins and improve liver function and all sorts of kinds of things. But I will not be drinking olive oil anytime soon.
Not on your list. Also, not on my list is drinking my own pee. I won't do that.
Oh my gosh. No, thanks. Yeah.
I've heard of that, but not the olive oil.
Yeah.
The most outlandish thing you've ever tried for your health?
This one has to do with peptides. So there is a peptide called melanotan.
Yes, I heard about that one.
And unfortunately, right now, it's not available through compounding pharmacies. There's a few that still carry it, but melanotan was a peptide or is a peptide that can help us achieve a natural tan.
Ken and Barbie peptide, right?
Yes, exactly. It can also help with libido. It's actually a really great immune modulator, but I don't tan. And melanotan didn't help me tan. I actually ended up getting some dark spots from it. So I tried it and I really loved how I felt with it, but I did not achieve a tan. I got more dark spots than I had to laser off.
Yeah. I in my early on in my career as a pharmacist, I interviewed for a position for a compounding dispensing situation where I would be the pharmacist in charge of dispensing melanotan. And so I did a bit of a deep dive on it and I was like, this sounds really, really nice because it makes you more tan, improves your
Yeah.
libido. I feel like maybe some weight loss benefits, but those dark spots, it was like it can make your moles so much darker. And I'm already a very moley person where
Me
I'm like,
too.
I'm not sure that I want more moles in my life. Like I want to
Yeah.
kind of keep the ones I have under
Yeah.
control.
Well, I can confirm that it will make your moles darker.
Thanks for testing that for all of us.
Yes, you're welcome.
I never did get to try it and I never did take on that position. I want to say it was in 2007, 2008. So it was a while back and I brings back some memories for sure.
Yeah.
What's a supplement that you'll never give up? If you had the supplement police come to your house and were like, you need to surrender all of your supplements, maybe therapies, medications, is there something that you would just be like, they would say, you could just keep one? We're going to be good to you and we're just going to let you keep one. Do you have one that you would keep?
It would be either my peptides or my hair supplements.
Okay, got it. I'm like, it's like choosing a favorite child, right?
Well, it's sort of like what's good for your hair is good for your whole body, right? Like from the nutrition perspective. But then, like, I love my stem oil and troches. That is one thing I would never want to give up because it's good for your skin, it's good for your hair, it's good for your hormones, it's good for your muscle mass, it's good for so many things. So now that I'm talking out loud, I think it would be the my stem oil and troches, which is technically it's not a supplement, but if I were to think about what I couldn't live without, it would be that.
Okay, amazing.
Hmm.
And do you have any like guilty pleasures that aren't like doctor approved that somebody might see you out in the world and be like, I cannot believe Dr. Elena is doing that. What is she doing?
Well, as you know, I just came back from Japan. And in Japan, they put matcha in everything.
Yum.
And I discovered matcha Kit Kats.
That sounds amazing.
It really is. So lately, I mean, I did bring some matcha Kit Kats back with me. And we went through that bag pretty quickly. So that's been my guilty pleasure.
I love it. Yeah,
Yeah.
I try to have like if there's a Coke or something with like
Yeah.
real sugar whenever I go to Europe,
Yeah.
I'll be like, okay, I'm having one of these because
Yeah.
you'll never see me with a Coke in the US. But
Totally.
if I go to Europe, like I'm drinking out of the bottle
You
and
got
people
it.
might see me. My husband always will be like, I'm going to take pictures of you for blackmail, right?
Exactly. Yes.
But it's good to have a little bit of fun too and just be able to live a really balanced life versus being so, I feel like, very obsessed or orthorexic. I know when I was first started on my healing journey, I was like, I can't have this, I can't have that. And it was a big source of stress for me. And I'm sure as you went through your training as a healthcare professional and seeing your patients, you realize that it's okay not to be like 100% of the time, right?
I agree. We're human. And it's actually part of my philosophy. Like, I won't take away people's cup of coffee away.
Yeah.
That's just mean. And unless I can commit to it, I'm not going to be saying that, right? I think it's part of life and it's part of the balance. And what's the point of living if you can't enjoy those things every once in a while, right?
I agree with you. I used to recommend that people give up their coffee, sleep for 12 hours a night, and decommit from
And
everything.
then you became a mom.
And then I became a mom, right? To balance their adrenals. And I was just like, wow, that is so unrealistic. And I just, when I was a new mom, and I'm actually not a coffee drinker,
Hmm.
except for when I was like a new mom, like 6 to 8 months postpartum, I was like, bring it on. My husband
Yeah.
would get giant bags of like bulletproof coffee, and I would
Hmm.
be like crawling to my coffee machine to get my morning like dose of caffeine and coffee because I just needed it to get by. And of course, now I'm wiser and older. And so if somebody is drinking a lot of caffeine,
Yeah.
we work on their adrenals, but I'm never like, you need to quit cold turkey or you need
Yeah.
to completely be off of this. We try to have a healthy relationship with food, with caffeine, with supplements, and
Totally.
yeah.
Being in the functional space, it's really, you kind of tend to go to the extreme first, but then you realize that it's not sustainable and you're not a really pleasant human being to be around and people don't want to go out to eat with you. So it's nice to kind of find that balance and that it's not the end of the world. It's just it's hard nowadays, you go to a grocery store and it's like there's so many things that are screaming to capture your attention. So it becomes really important to like, well, if it's, if you are having more than 2 cups of coffee per day, as an example, like, let's talk about that, right? It's not like we're saying no to coffee. We're just saying there's a happy balance.
Yeah, absolutely. And I feel like when you have a lot of tools in your tool belt, you can actually have a better balance than if you were just to focus on like medications alone or nutrition alone or exercise alone or supplements alone as the be all end all to, you know, feeling your best, right? And thriving.
Totally. Yeah.
So thank you so much for joining us. This has been an incredibly amazing episode. It's been so fun, so much pleasure getting a chance to pick your brain.
Thank you.
This for everybody listening, I hope this has been a healing conversation, and I look forward to future conversations with you.